All right, Dr. Patel, you mentioned to me, we talked a little bit about missing teeth, and you explained it very well that if the missing tooth is somewhere in the middle, in the back there, that yes, it does create problems. It makes other teeth be lost soon, and it creates decay, it creates gum disease, it might even create migraine and all that stuff. So, what are our ways of replacing such a missing tooth these days? What options do we have, and have there been any advancements made in the last, whatever, decade or so, or has it been at a standstill ever since George Washington had a wooden tooth?
The best alternative today in dentistry is to do implants. Implants are just like real teeth, and any person can have implants today. They're also becoming very affordable, and therefore they're a very, very good alternative to replacing missing teeth. There are obviously
And an
also
implant,
less.
let's talk a little bit, just very little bit. An implant basically is a metal stick. I think you guys make them out of titanium, like the same way you do hip replacement type of stuff. And you basically screw it in into the gum, and then you put another crown on it, right? That's basically
Exactly the same concept. It came out of orthopedic surgery, where now we are using a simulation of a root made out of titanium that's screwed into your jaw, and then a tooth is constructed over it.
Okay, good. All right, so that's the implant thing now, and that's. I mean, implants have been around for a while, but I'm sure they also improved with this titanium and with the way you place them. So tell us about the other methods which are there, and like for instance, the bridge or so. I mean, those things have been there for a long time. Are they totally outdated or still have value?
They have value in certain places now. If you have virgin teeth besides a missing space, then it is very important to consider not doing a bridge. A bridge is more affordable sometimes, but now since the prices of implants have come down, a bridge and an implant is the same cost. The consequence of doing a bridge is that you are having to cut down a tooth to restore. When you cut a tooth down, the consequences are that you are inflaming the nerve. You may need a root canal. Once you need a root canal, the tooth may fail. Now the tooth needs to be taken out. So the safest bet is still an implant. A bridge is a good choice if you have crowns on either side of the missing space, because now the teeth have already been crowned. You remove the crowns and you replace by doing a bridge. And the third alternative is just a retainer made out of metal, which is very clean, which is very, very reasonable, and that can be used also, but it's removable and it's an inconvenience to the patients.
Could a patient, let's just say, he needs to replace this tooth, but he doesn't have the money, be it for a bridge or for an implant, which more or less is the same, as you said, but he just simply doesn't have the money. Would he be better off putting a retainer in for a year or two, or whatever it may be, 6 months, save up for the bridge or for the implant, and then do it the right way? But so would that in between nevertheless make sure that his teeth are not shifting and that all these other problems are because of it not occurring?
That's exactly it. You've got exactly what I said, is that you want to try and retain the space, you want to try and retain the teeth in their same position, and in order to do that, you can get a simple retainer that would assist in keeping everything as is until such time as you have the money and the funds to replace it with an implant or a bridge or whatever your choice might be at that time.
Got it. Now, I've heard that when you do a bridge, you need to be very, very careful, more careful than otherwise, in terms of flossing your teeth. Because when you have a bridge, it's like melted together. It's like really welded. It's still really one piece when it goes in. So you can't floss in between, which means food and other things can get stuck underneath, which is why you have to take this little, whatever, this needle to go. Now, if you're a little slappy guy like me, when I go to the bathroom at night with my wife, she flosses and brushes. I shower, shave, floss, brush, and I'm still done earlier than she's done with just the flossing alone. Meaning, you get what I'm saying. So a guy like me, is it true that if I have a crown, I am probably more likely to get a gum disease in that area, which in itself, again, is just not a good thing, and will eventually make the bridge failing anyway, because, you know, when the foundation rots out, then it wouldn't matter how good the stuff on top is. So is that a concern? Tell me about it.
Bridges, the statistics show that the bridges always fail because there's decay or pocket formation around the supporting teeth. And the main reason, like you described, is that patients are not able to or will not floss the pontic, which is the missing tooth in between the two teeth. And it is a difficult situation, and bridges only succeed in patients that are extremely, extremely good at their oral hygiene. So failures in bridges are very common, and the only reason they fail is what you described, is inability to clean in between where the missing tooth was placed.
Right. Okay. So that is so that is something to be aware of. It's
Aware
not
of when you
it,
want to
to have
go ahead and have a bridge instead of any other choices
okay.
that the
All right.
dentist might give you.
Yeah. All right. And then you said that one of the reason the implant is a little bit is not maybe a little bit, a lot, you know, better, is you really only have one implant. It puts in the root with the implant. You have it. You don't touch the other teeth, so you don't down the road have three teeth failing. You know, there's just that one. You know, but
And,
kind of
and,
like.
and the implant is made out of titanium. It does not decay.
Mm,
It can get gum disease, but it does not get decay.
mm,
So therefore, if you are careful, the implant is much more successful than anything else.
mhm. Right. And as you said, because there's only one and the price of the implant came down, you know, instead of three crowns, which a crown is actually, you know, it's laboratory work and it's relatively expensive, you only have one of them now. And even though the implant is expensive, but more or less the price almost equals out now for one implant, and one 3-unit bridge is more or
Yes,
less, yeah.
yes. Yes, it's become the same now because implant prices the manufacturers are bringing down, and that's being passed on to the consumers.
Beautiful. Well, probably more people do it. The technology, just like with everything else, computers and stuff, you know, that's more people use it. They get easier to make. They find out how to make it easier and better, and thus prices can come down. Wonderful. Well, again, I guess there was an improvement from the wooden tooth from President Washington or whatever I think who had it.
Yes, it is.
Did he really have one? I mean, is that a myth, or did it really happen?
No, it is true. It's true. They have it in a museum. They have those wooden teeth.
That must have been awfully uncomfortable,
Yeah,
huh?
they
and,
have it
and
in a
and
museum.
even then, it probably was better than not having teeth, right?
Oh yes, yes. That's what dentures are. People wear them, and at least they have something to chew with.
Wonderful.
You know.
Let's talk about them, in fact, rather soon. Thank you very much, Dr. Patel.
Uh-huh.